Hello, my name's Charlie Till. I'm one of the education team with the Scottish Ambulance Service, and today we're going to look at systems examinations. We're going to start with the preliminary assessment, which we will do before doing any of the other system-specific exams, and then we will look at individually all the different system-specific exams in separate videos. We're going to start with a preliminary examination, which means looking at the patient's hands, arms, and looking at their head and neck, assessing for any general clues and bits of information that could help inform our clinical decision making. So I'm going to start by looking at the patient's hand. Initially, I'm just feeling for the temperature of the hand, making sure they don't feel too warm or too cold. I'm also feeling, are they particularly clammy, and the sort of moisture level of the skin. Along with that, I'm going to check for skin turgor on the back of the hand, which means pinching the skin on the back of the hand up and then letting it drop down again. It should drop straight back into place, but if it stays up and moves down slowly, that's a sign of dehydration. I'm also going to assess for any signs of clubbing, which we may see on the fingernails if it's quite extreme, but to make sure and check for more subtle clubbing, I'm going to get the patient to take both their pointer fingers, bring them together, and hold them up for me to look at. And what I'm looking for, which is normal, is a nice little diamond of light. That's fine, thank you. A nice little diamond of light between the fingernails. If that is an open diamond, then that is a sign of clubbing, which is obviously a concern. So I'm going to look at the patient's nails for any general clues, such as any white marks or lines across the nails, any splinter hemorrhages, and I'm also going to feel the nail for what we're going to call Bow's line, which is a dip across the nail transversely, which is just a sign that the body has not put as much effort into growing the nail at a period of time in the last few months due to severe illness. I'm then going to check the patient's capillary refill, which, as we know, should be under 2 seconds. I'm also just going to inspect the hand, the fingers and the palm, looking for any palmar erythema, any nicotine stains suggesting that they're a heavy smoker, or any other clues such as Osler's nodes that might give us a clue to the patient's health state. I'm going to just check a radial pulse, make sure that's good, strong and regular. If I'm focusing on the cardiorespiratory exam, I would also check bilateral radial pulses, and I'd also check ulnar pulses on the opposite side of the wrist. Whilst I'm doing this, I'm also going to check for a collapsing pulse. So I'm just going to have one hand supporting the elbow whilst the other hand feels the pulse. You've not got any shoulder problems or anything, have you? No, fantastic. I'm just going to lift your arm up quite sharply, but let me do that for you, okay? I'm going to lift the patient's arm up quite sharply, and I'm making sure that that pulse persists through the movement and doesn't drop off, and that's checking for a collapsing pulse. I'm now going to look up the patient's arms. I'm looking for any wounds, any recent tattoos, any scars that could all be potential sites of infection. I'm also looking for any track marks, which could be suggestive of either illicit drug use or recent hospital visits. I'm also looking for any other marks, any bruises, any rashes. Bruising that's unusual for the patient could be suggestive of some kind of clotting disorder. Once I've looked at the arms, I'm going to move up and look at the patient's face. I'm going to start with the eyes. Can I just ask you to pull down your eyelids for me? Thank you. So I'm looking in the conjunctival bed to make sure it's nice and pink. Thank you very much. If it's particularly pale, that could be a sign of anemia. I'm also looking in the whites of the eyes for any sign of jaundice. As we know, jaundice shows up initially in the whites of the eyes before it would become present on the skin. Also, I'm looking for signs of high cholesterol or poor vascular health through either calcium or cholesterol deposits on the eyebrows or eyelids called xanthelasma. I'm also looking in the eye itself for a silver ring around the iris of the eye, which is called arcus senalis or arcus lipidus. I'm going to look in the mouth. Just open your mouth for me and stick your tongue out and say ah. Ah. Fantastic. If you need to, you can use a pen torch to look in the patient's mouth. I'm looking for signs of hydration, so furring of the tongue would be suggestive of dehydration. I'm also looking for any mouth ulcers or any other gum conditions that could just give us an overall picture of the patient's health state. The gums being particularly pale could be another sign of anemia. I'm now just going to feel your lymph nodes. So I want you to keep looking forward for me, but I'm going to walk behind you. And what I'm doing with both hands is I'm palpating under the patient's chin, starting at the point of the chin, and moving just inside along the inner jawbone, and then down the front of the neck. I'm coming up and feeling the front of the ears, and behind the ears, and down at the back of the trapezius muscle, and again just at the back of the neck on either side of the spine. What I'm feeling for is any inflamed or swollen lymph nodes. Normal lymph nodes are not palpable, so if you can feel them, then there is some form of problem. If they are particularly hard and pebbly and not tender, that could be a potential red flag for cancer, as is fixation of the lymph nodes, which is where the lymph node does not move freely as you palpate it, which indicates it's become fixed to surrounding tissue or underlying bones, which again is a red flag for cancer. You may find the lymph nodes are tender, and when they're palpated they are rubbery in nature, and that's suggestive of inflammation due to infection. And if it's localized, that's a sign of a local infection, and if it's widespread, that's more concerning as it points towards a systemic infection. Now that I've assessed the patient's preliminary systems and looked for any peripheral stigmata, I'm able to carry on with a system-specific examination based on the clinical picture that's presented to me.